So my full name, let me give you the full Nigerian flavor. My name is Chioma Izzi-Engbeaya. I have all sorts of letters after my name, and I am a postdoctoral research fellow in Imperial College, and I'm a consultant endocrinologist in the trust, and I also have a role in a medical school. Okay, so in 1995, bright-eyed, bushy-tailed, I moved from Jos in Nigeria, which is an ex-mining town, which became a university town, to Sheffield, which, surprise, surprise, is also an ex-mining town, which became a university town. And I guess that's where the similarities ended, because obviously the weather was very different and the demographics were very different. In any case, I did my A-levels, etc. I did a gap year in Manchester, and then I moved down to London for medical school. So enjoyed myself, did everything I was supposed to do. And then when I could still be bothered to wear makeup, I became a junior doctor and worked in London hospitals, doing my initial training. And then I had my first child, and I started my specialist training, which is where you specialize essentially. And I started that full time and then went part time after I had my second child. So in medical training, traditionally, you spend the first bit of your specialist training in the district general hospitals, and then you rotate into the teaching hospitals for the second half of your training. So when I rotated into a teaching hospital, which was Charing Cross Hospital, which obviously is part of Imperial College Healthcare Trust and has a very close relationship with Imperial College London, I decided I'm in a very research active environment. I think I'd like to get a bit of experience of research. And obviously, I guess the mercenary part of me thought, yes, I think it will improve my chances of getting a better job as a consultant. In any case, so for 1 year, I was fortunate enough to get a research fellowship for 1 year, sponsored by the Imperial Health Charity. And that allowed me to generate pilot data and start preparing applications for funding. And this was really important because obviously as a doctor, it's really hard to have the time and headspace to get the pilot data, to put together a solid application and have interview practice. So this 1 year was really, really useful. And at the end of that 1 year, I applied and I was successful, and I got funded by the Medical Research Council to take a PhD. I decided to have another child for what it was worth. And then in 2018, I handed in my thesis, had my viva, and completed my PhD. So after that, I went back and completed my clinical training and part-time I continued my research as a postdoctoral fellow. And then since then, I have successfully been awarded some bridging funding. So when you go from being early postdoctoral, before you're really independent, you need intermediate funding, which will last about 3 to 5 years while you establish yourself and you grow. But it's difficult to get that. And so I was able to get bridging funding from Imperial College, which is kindly extended because of COVID, etc. And what have I been doing? So I've become a consultant. So I've completed my clinical training, and now I do clinics specializing in endocrinology and bariatric medicine, as well as do general medicine as well. And I am a postdoctoral fellow, continuing my research and applying for funding. And in the medical school, I'm the EDI director. So just to give you a little bit of flavor of what I have done and what I am doing. So in my PhD, I undertook basic science research and using animal models, and this time it was in rats. And when I want to sound really slick, I say, yeah, I did brain surgery in rats. Anywho, so when that was published in Molecular Metabolism and Diabetes Obesity Metabolism, but the bulk of my research work is actually in preclinical translational research. So not quite where you have big clinical trials, but definitely moving on from animal work and bench work. And that's what I've done a lot of my research in. And then my clinical research has been predominantly looking at our patient database and trying to find things that, indicate poor outcomes, so that we could perhaps target our treatments better, or that could be the focus of more research, will actually lead to more basic science research, more clinical research. And indeed, just to give you a flavor of the different things I've done and the options available, within research, and especially in a field like bioengineering. You can do lots of different things. And so, as you can guess, I have what I call a portfolio career. Obviously, if you're not a clinician, you wouldn't be seeing patients. But I think as you go on after your PhD journey, if you decide to stay in academia, you will be doing quite a few different things. So collaborations are obviously an important part of your development and networking and moving your research forward. I also publish. I still do research. I get involved in the next generation, basically interviewing people who want to come onto programs, teaching people who are on programs, and also supervising undergraduate and postgraduate projects as well. And that's it.